exempted. So the question is then that burden is going to be transferred more and more and more to families that didn't have a health care plan negotiated by a union. Again, that's the reason I think, as the gentleman stated, is that we need to be doing this in the light of the day, because the American people need to see what's going on here, and quite honestly, what's going on isn't necessarily in everybody's best interest. I yield back to the gentleman.
Well, I thank you. Thank the gentleman for that. It strikes me that perhaps we need to bring in a facilitator, given the spirit of the Democratic leadership's health care bills and on this, and perhaps we could see if Monty Hall is, I don't know if he's still alive or not, but if he is, perhaps, the old game show host from Let's Make a Deal, because that seems to be, as I follow this, and it's obviously it's what's reported in the media and what the Democratic caucus reports, there's a lot of deal making, whether it's a hospital, I believe in Connecticut, one hospital being purchased helped to secure some votes, whether it's Nebraska getting exemption on any future medical assistance increase, even the Democratic governor of Tennessee. I love what he called that. I've never met the man, but I have a lot of respect for how candid he is. He called that the mother of all unfunded mandates, what it does with medical assistance. I know in Pennsylvania, our medical assistance bill over 10 years of medical assistance is expected to go up under these Democratic leadership health care bills, $2.4 billion. We were in a financial meltdown as a state this past year. I mean, we went 6 months without a budget because those folks who were serving in the state legislature, the governor, they couldn't balance the books. They couldn't get the revenue to match expenses, and now we've got this unfunded mandate coming out of $2.4 billion for the Keystone State. Now that was before, I think, the Nebraska sweetheart deal was made. So I'd be curious to know what portion of paying for Nebraska do the Pennsylvania taxpayers have to make up, because it's going to, every other taxpayer in America is going to have to make up for what these sweetheart deals that are made. So I will. I thank the gentleman, and I'll yield back at this point.
Well, I thank the gentleman, and one of the things the gentleman brought up is I think the American taxpayers didn't get the benefit. Here is someone that I think you said over 30 years in the healthcare professional. As you know, in the Congress, we have, particularly on our side, we have a number of physicians that have worked in healthcare, have dealt with Medicaid, have dealt with Medicare, have seen the private payment system, all of the existing systems bring a huge amount of knowledge to this process. But unfortunately, the American people didn't get to benefit from their knowledge, your knowledge, quite honestly, it's a shame because, as you said, you have 660,000 customers, and every member of Congress has about 660,000 people that are looking to them to come up here and have serious discussion, serious debate, and work on things that are good for the American people. And it's not good for the American people when very few people sit down and make a decision about something that's going to impact not only my 660,000 people, but yours and the other gentlemen from Ohio. And this is serious policy. It's now my pleasure to recognize the gentleman from Ohio, Mr. Latta.
Well, I thank the gentleman for yielding. I greatly appreciate him hosting this special order late this afternoon. I think it's very, very important that the American people actually know what's going on here. And, as we all were home over the Christmas holidays, I know that I had a lot of different events that I had to attend. And, I don't care if I spoke at a Chamber of Commerce or a Rotary, you name it, people are very, very concerned with what's going on in this chamber. And the thing that they're worried about a lot of things. They're worried about the health care that's been passed by this House. They're worried about jobs. They're worried about the cap and tax legislation. They're worried about the EPA and other mandates that are being forced down their throats. But I think it's important probably to just start off talking about the health care a little bit here. I don't think there's anybody in this chamber, and there's not one person in this country that wouldn't say that we shouldn't do something about having some meaningful debate on health care in this country. But when we're looking at it, what we've seen happening is we've seen as been mentioned by my colleagues from Texas and also from Pennsylvania, it's been a one-way street. And the American people don't care for that. They want an open debate, and they want to make sure that they know what's going on. But as we're talking about this health care, I think it's important that we also know what the people back home are saying. When I'm home, I try to go, I represent the largest manufacturing district in the state of Ohio. I also represent the largest agricultural district in the state of Ohio. In 2008, I represented the 9th largest, according to the national manufacturers, the 9th largest manufacturing district in Congress. Because of what's happening in this economy, I've dropped to 15. And I don't even want to know when the next numbers come out to find out where the 5th congressional district is located in that long list. But when I go out and I go into the different factories and I go to the small businesses and I really want to know what's going on, that's the best way that I can gauge what's going on in the economy. And when I'm out there, one visit to one factory in particular really sticks with me. And a gentleman came up to me who was a press operator. He came up to me and says, you know, I really don't understand what you guys are doing in Washington. And he said, you know, you're all talking about health care, but you know, if I can't put a roof over my family's head, if I can't put food on that table, why do I care about health care right now? I worry about jobs, and I worry about my job. And I think that that's something that has been lost in this. I know that one of our colleagues from the Senate recently said that maybe in the past year that the Congress here should have been really concentrating more on what? Not health care, but on job creation. Because let's just talk about these jobs and what's happening out there, not just from that individual that works on that factory floor and just an individual like everybody that you know that might work in a factory across this country. But also, I remember walking and being in one of my small business owners' stores in the district. And after I was in the store and I'd bought some things, I was walking out and he said, can I talk to you for a little bit? And we stood out. It was pretty darn cold that afternoon. But we stood outside for a good long period of time. He said, let me tell you something. If you all pass this health care legislation, I'm out of business. He said, there's no way. He said, you know, even though, you know, your bill was over 1,000 pages long, and I know that the Senate bill was going to be several thousand pages, a couple of thousand pages long. But he said, what I've been able to get out of it, and what I've been able to figure out in the newspaper, he says, I won't be able to stay in business. And he said, look around here. Look at the people that are running the cash registers, stocking the store in here. They're all going to be without a job. And it's going to be one more store on Main Street, USA, that's going to be vacant. And we can't have that happen. And I think that what we need to do in this body is really go out and talk to these individuals. I've advocated. What we need to do is, you know, instead of trying to do a few hearings down here, and I don't think we had enough hearings when we were talking about health care and during this debate, I think what we should have done is taken these hearings across America and wouldn't have done anything but to help the American people to, first of all, have their say in what's going on, and two, that the members of this body would be able to hear it directly from the American people. I know when I served in the Ohio legislature for 11 years, you know, when you're representing the state of Ohio, it's not that large of a state, and we'd had, you know, many a times we'd have all of our hearings in Columbus, but many a time we would take our hearings out across what we call the 4 quadrants of the state and hold hearings in different areas. And that's so that people could actually come to nearby where they live. They didn't have to drive down to the state capitol. But I think that's what we should have done in this whole debate in health care. Let's bring these hearings to the American people, let them have their say. That's where we're going to find out. That's where we're going to find out what they're going to have to say about this. Because, you know, this is where they start finding these things out. You know, when you're talking about jobs killers, you know, the model that was being advocated by Ms. Romer, we could lose up to over 5 million jobs in this country. And the National Federation of Independent Businesses, just from the employer mandate of on small businesses across this country, they're estimating 1.6 million jobs could be lost. 1.6 million jobs. That's on top of the millions of jobs we've lost since the beginning of the recession, and also, you know, there's almost 3 million jobs since the beginning of last year that have been lost just from the beginning of this administration. We can't afford to lose more jobs in this country because where are these people going to go? You know, it's not that hard to remember back to 1982. In 1982, during that very tough recession, we can all remember because President Carter, during his administration from 1977 up to 1981, had created, during the campaign when he was elected, what he called the misery index. And that misery index, you know, you took the unemployment rate, the inflation rate, and the interest rate. Well, what was it during his administration toward the end? You know, we saw in this country 21.5% interest rates. We saw unemployment rates at double digit, and we saw the inflation at double digit. Well, you know, where we are today, you know, when we look at having over 10% unemployment in this country, and we're talking about losing millions of more jobs because of this bill, we can't afford it. And, you know, just go down these, and what the other things that, you know, when you're just not talking to the small businesses and small factory owners out there about what's in this piece of legislation besides all these mandates, but let's just talk about the taxes in it. This was prepared by an analysis that was done by the Committee on House Ways and Means from the ranking member Dave Camp. And since the increases in 2009, the taxes, just in general, were $1.71 trillion in net taxes that were passed by this House. And just this health care bill, the estimate on this health care bill alone is they're looking at over $732.5 billion. That's billion dollars. And who's going to pay for this? They're looking at that 5.4% surtax on a lot of the small businesses that are the ones out there that create out there, and on certain individuals out there at a certain higher level. When you're looking at $460.5 billion in taxes, when you're looking at these employer mandates at $135 billion, and you go right down the line, this is what's going to kill incentive in this country. This is what's going to kill the entrepreneur. This is what's going to kill people who say, why do you even get up in the morning and try to go out and create jobs? Because one of the things that's lost here in Washington and in these halls of Congress is that this body does not create jobs. This body spends the wealth of this country. And, you know, the American people are really out there and they understand it. And, you know, when you look at, as was mentioned a little bit earlier about what's happening with the increases, when you're talking about, on the Senate side, a 40% tax on those individuals out there with a quote-unquote Cadillac plan. Well, you know, a lot of people say, oh, Cadillac, they must be rich individuals. Well, I tell you what, in the state of Ohio, we have a lot of auto plants. And when you're looking at these auto plants, a lot of these folks out there are the auto workers that are going to end up paying 40% on an individual premium or an individual at $8,500 on their health care plan, a family plan at $23,000. And when you put these together, it's like, how are they going to pay for this as a small family? When you take all these costs that are being associated under this piece of legislation, it's unfathomable. You know, and when you were talking about unfathomable, I did read the health care bill. You know, sat down one weekend, I think it was 1,028 pages. Read it, tabbed it, underlined it, so I could really get a good understanding. You know, looking at a couple thousand pages on the Senate side. But I think what's missing in this whole debate is, you know, here is what someone gave me not too long ago, the Constitution of the United States. But, you know, as that little commercial on TV says, but wait, there's more. In this little book that's in about 10-point type, there's the Constitution, the Convention, the Congressional resolutions, all of the amendments, the Virginia Bill of Rights, the Declaration of Independence, the Massachusetts Bill of Rights, the Articles of Confederation, the Virginia Statute of Religious Liberty, the Annapolis Convention, the Virginia or Randolph Plan, the New Jersey or Patterson Plan, the Hamilton Plan, and the Great Compromise. Right there. That is America in a nutshell. How is it that we end up today putting out thousands of pages that people can't comprehend, but America, our government, and how we were founded is right there. Put it in your pocket, you read it at any time. And I think that's what the American people are very concerned about, and I appreciate the gentleman for yielding.
Well, I thank the gentleman for pointing out the taxes that are in this bill. I think the bad news is that they're going to have to be higher taxes because they are disguising, as you know, what this bill actually cost. Now, the stated cost that the Speaker of the House says is this bill cost $891 billion. But if you add the mandated cost of the employer mandated tax, it's another $135 billion. And you add the cost of individual mandate tax for individuals that are going to be penalized if under this plan, it's another $33 billion. And so the total cost, the CBO score, is $1.06 billion. You don't hear the Speaker or the leadership or the President talking about this number. Now, here's the other piece is that, you know, in the House bill, there is no provision for what is being called the doc fix. Today, we have reimbursement levels that are being projected to be reduced by a substantial level, and which is going to cause more and more doctors not to see Medicare and Medicaid patients. And so this leadership team has promised and made a deal with the docs that they will bring a separate bill. They don't want to bring it in this one because why? It cost $209 billion, and so now instead of 1.06, you've got nearly a $1.2 trillion bill. Now, the other piece is that the Medicaid is being transferred to, the part of this cost is going to be Medicaid that's going to be transferred to states, unless you're from Nebraska. What is the cost of that? That's $34 billion. Now, here's the real sleeper here that I hope that the American people are watching C-SPAN and the light, because the lights are on here and the lights are on this chart. And guess what? This little bill only, it collects taxes that the gentleman was talking about for 10 years. But it only has expenses for 7 years. Now think about all of the businesses and families all across America that if you could collect 10 years worth of salary, but you only had to pay 7 years worth of expenses. That's like the first 3 years you don't have to make your house payment, you don't have to buy your gasoline, you don't have to make your car payment, you just get your paycheck. Nothing taken out of it, no Social Security, no withholding. What a great deal that bill. Well, that's the way this bill has been put together in order to disguise the real cost of this. And so once the 3-year period passes, then on an annualized basis, this bill cost another $727 billion more than what it's being represented to the American people. So what does that total? $2.1 trillion. And so a bill that this leadership says that it's $891 billion. It's not $891 billion. It's $2.1 trillion. And at a time when the gentleman was talking about small businesses are struggling to keep their doors open, and in my district, and I think the gentleman's district as well, small businesses play a huge part in creating jobs. And if we put more, who's going to pay this $2.1 trillion? Because the taxes that they're talking about collecting only pay for a bill that cost $891 billion, but this bill cost $2.1 trillion. Now, here's the other thing that people have looked at. This bill mandates, as both of my friends know, mandates that every American have health insurance. And in fact, if you don't, there's a penalty for it. And so one of the things that people say that if the government is requiring you to do something, to pay for health care or to have health care, and there's a penalty for doing it, it becomes a tax or a cost. Some people that have kind of calculated what that means into the economy and GDP and overall said maybe that's a $4 trillion number. And so that possibly, really what we're looking at, if we put all of the shed light on this bill as we should, that really the impact of this is it's a $6 trillion piece of legislation. Now, I don't know about you, but I think the American people think that whether it's $2 trillion or $6 trillion or even $891 billion, that we should have had more debate than we did on this bill. As the gentlemen, my friends, colleagues will remember on the day that we passed this bill, very little debate was, I think, one amendment to a $2 trillion, $6 trillion bill was allowed. And so these are the kinds of things that caused me to say, you know, Mr. President, we have to hit the pause button here because we're talking about something that impacts families all across America. We have some number here that are big. We are now spending money that we don't have. Every dollar that the government spends, they have to go out and borrow nearly 40 cents of that from people like in China and Japan, and it is not a sustainable thing. And yet now we're talking about more taxes and I think potentially bigger deficits because we've not had good discussions on this bill. Now, you'll have some additional time to reflect on these important issues to the gentleman from Pennsylvania again.
Well, I thank my good friend for yielding. I just want to come back to you hit on such an incredible point about individual mandate to purchase health insurance. Now, wouldn't consider myself in any way a constitutional scholar. I'm just an American and a citizen. But my good friend here has a copy of the Constitution, and as I've read, and the one version I carry around is about 28 pages is the Constitution. I think that was put together by some really smart people a long time ago that has served the test of time, and really our Constitution has become a model for other countries and emerging countries to base their